Welcome to the LSU NCBRT Preparedness Podcast. I'm your host, Ashley Markle. I'm a curriculum development specialist here at NCBRT, and I work in collaboration with subject matter experts to create valuable and timely training for the responder community. The National Center for Biomedical Research and Training provides mobile training to both the national and international emergency response community. Welcome back to the podcast. Today I'm talking to Tim Redding about bag valve masks, or BVMs. Tim, could you go ahead and introduce yourself and tell us a little bit about your background?
Sure. Thanks, Ashley. So my name's Tim Redding, born and raised in New England. As far as my EMS background, I started in 1992 up at my college in Maine. They had an ambulance service, and then officially became an EMT in 1994. Worked as an EMT for a couple of years and an ER tech, and then in 1996 got my paramedic. Been a paramedic ever since, except for a few years here and there. I've always worked in the field. Still work per diem job at a hospital-based EMS system south of Boston. I'm in Pelham, New Hampshire, just over the Massachusetts border. And I also have been teaching, instructing EMS stuff for fire EMS in hospital folks since 1996, 1997. Have my own business, medical education business called Emergency Education Consultants, and I've worked for LSU for going on 6 years. I teach the ATURC class, and the ATURC train the trainer. And I also presented EMS conferences throughout the United States, and I've done some international stuff as well. That's me.
Great, thank you. So in this series, we're going to talk about 5 very common mistakes associated with this device and how they can be mitigated. So the first 3 mistakes have to do with problems using the device itself. We'll dive into those during this episode. And next time we'll talk about 2 mistakes associated more with the human error side of things and how those can be mitigated with proper usage. So to start us off today, can you just tell us a little bit about what a BVM is and how it has been used both historically and up until today?
Sure. This is a BVM, and it stands for bag valve mask. There's a bag here, and many of them have an extra bag off the end that extra oxygen can go into if you need it. But here's the bag that you squeeze. Here is the one-way valve. So when you squeeze, a little bladder opens up and the air goes through the mask. You don't always need a mask. You can take the mask off and connect this to a endotracheal tube or something like that. So that's a BVM, very common tool used in the medical field. And the history is 2 German physicians in 1956 invented what they called the artificial manual breathing unit, or AMBU. That has sort of evolved to, there's a company now called AMBU. So most people call it a BVM or an AMBU bag, but most people associate that with the actual bag that's made by the company AMBU, but that's what it actually meant at first. And the one in 1956, if you look up a picture, doesn't look much different than this. So we've kind of been using the same tool for a really long time, but we need to change that up.
Thank you. And I should have said this at the top for anybody who's listening. This is going to be a very kind of visual series because we're going to be talking about different kinds of equipment, and Tim's going to be able to show us some of that. So we highly recommend checking out this episode on YouTube, where we post all of our podcasts as well. And there will be a link to that in the show notes. So yeah, thank you. So can we go ahead and dive into those first 3 common mistakes when using a BVM and how those can be mitigated?
Sure. So the first 3, which really have to do with user error as opposed to the actual device. But the first one is volume, giving too much volume. Like if you took this bag and squeezed it all the way in the patient, you would be giving them too much air. The second one is rate. So you can squeeze this 10 times a minute, or you can squeeze it 40 times a minute. And we'll talk about why rate is bad. And the last one is what I call speed or pressure, and that is how fast you squeeze the bag. It means the air coming out of here is going to have more pressure, measured in centimeters of water pressure. So this might make a weird sound, but it's gonna look like this. If somebody were to take this and squeeze it really fast, they're getting all of this air in a much shorter time than if they squeezed it slower. So those are the three sort of common user error problems with the BVM. And now let's talk about them a little more specifically and what we could do about them. So volume. The size of your lungs is determined by sex, male, female, and height. So there's an ideal body weight chart that anybody could look up that depresses most of us because it makes it look like we're much bigger than we should be. And for instance, for myself, I'm 5'11" male. If you look up the ideal body weight chart, I'm supposed to be about 75 kilograms, whereas I actually weigh 210 right now, which is more like 90 something kilograms. But even though I have more weight and fat, my lungs are the same size because I'm a 5'11" male, 5'1" female. Your lungs are the same size. So if you give the starting ventilation amount, which people will argue is anywhere between 6 and 8 milliliters of air for every kilogram you weigh, then if we did 6 milliliters per kilogram and I'm supposed to weigh 75 kilograms, you're supposed to give me about 450 mLs of air with each breath. But the normal adult BVM is 1500 mLs. So if you were to happen to squeeze with both hands and do something like this, you're probably getting in 1100, 1200 mLs of that 1500, which means you'd be giving me almost 3 times more air than you're supposed to give. Now, talk about a 5'1" female that's supposed to get about 330 mLs of air, and you do the same 1100, 1200, you're giving that patient almost 4 times as much air as they need. And the reason that's bad is because if you fill up the lungs too much, it can damage the lungs. Also, if this is with somebody in shock or a cardiac arrest, when you fill up the lungs too much, it presses on the vessels that bring blood back to the heart. So you're actually decreasing blood getting back to the heart, which in most cases is not a good thing, particularly cardiac arrest or somebody in shock. So by giving them too much volume, we can cause the patient to become worse when we're actually trying to make them better. There's 4 general fixes to volume. One is sort of the most purist, we'll say, is use a ventilator, right? Some EMS systems now more and more are getting ventilators, but they cost $15,000 each. So most 911 systems don't have the ventilator. And the ventilator you can hook up, you can literally type in exactly how much volume you want, and it's going to do that. So that's great if you can afford or if you have the ventilator. The other way to do it, and this is a bit controversial and won't work on everybody, but if you grabbed a pediatric BVM, so just about every BVM comes in a pediatric size, and most of them are 500 to 600. And if you use that, And realistically, a 500 ml bag's probably only going to deliver about 350 mLs of air. So if you had a smaller female, that might work. For a male that's supposed to get 500, 550, 450, the pediatric bag may not work. So what I like to tell people is if you have a smaller adult patient, you can try it, but certainly be monitoring that patient and realize this isn't working. We need to go to an adult BVM. So that's a second way to fix it. The third way to fix it is just use this BVM the right way. Use the BVM you have in your truck. Use it the right way, meaning squeeze the bag. I'm going to try to show you here something like this. And that's it. And just pay attention to the chest rise. And most people, all you need to do is that. And then the fourth way, which is a very unofficial way, is most BVMs, when they come out of the package, they come sleeved in like this. So if you actually open up this first one, put the bag on, but leave this last section sleeved in, that's going to deliver about 600 mLs of air. The only issue is for most EMTs and EMS folks, they know if they come in with a bag BVM like this, they might get in trouble with the ER. So, and again, with any of these methods, you have to constantly be monitoring to make sure what you're doing is actually working for the patient. So that's the volume thing. Now, many people ask if this is 1500 mLs and we don't need to give people 1500 mLs, then why are they still making and selling 1500 ml bags? And the reason for that is mostly is because we keep buying. Most people just hit reorder. Most EMS systems, fire systems, first responders, when they're getting low on BVMs, they hit reorder and they reorder the same one they've been ordering for 10, 15 years. So if people keep ordering it and they already have the machines that have the injection molding and everything else, why would they stop making? The good news is there's a lot of new BVMs coming on the market, and they are a little more money than the plain Jane one I showed you. And they are smaller BVMs. So, for instance, this is something that came out a couple of years ago, and this is, and you can sort of see the difference. This one is 1200 mLs, whereas this one's 1500. This one is 1000 mLs versus 1500 mLs, right? So if you're using a BVM theoretically that has a maximum of 1000, you're much less likely to overventilate them too much. So that's the volume issue. Let's talk about the rate issue, unless you have any questions, Ashley. So the rate issue is, as I said, hyperventilating the patient by doing this and breathing for them at 40 times a minute. And the reason that's bad is because the faster you ventilate for somebody, the more CO2 you're breathing out. And if we upset the CO2 balance, that can affect your body's pH and can make somebody more acidic or less acidic, which can be bad for the patient. So we do have to be careful about how fast we're squeezing. Plus, the faster we squeeze, the more air we're putting in, and that could affect blood return to the lungs and things like that. So the question is, how do we fix the rate? Once again, you can be very disciplined. And let's say you want to breathe at 12 times a minute. You can squeeze and then 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, and do that. The thing is, you might be very disciplined at that because you watch this podcast. But then you hand the BVM off to somebody, and they may go back to doing this because they didn't pay attention to this podcast or didn't watch it. So there's other ways to fix the rate problem. I'll bring up this BVM as well. And by the way, I don't have any financial interest in any of these. Most of these I actually bought myself, but I like to show uh, the different BVMs. They've made a lot of these new BVMs to fix the human error. So for instance, this one, and this is made by a company called Pomadyne. It's smaller, it's 1,200 mLs, and they have like football laces. And the idea is if you're on the laces, you put your hand through this thing and you're on the laces, where you squeeze on the laces can determine your volume. But on top of that, so this BVM has a switch you can turn here. And if you watch, if I squeeze this, it just goes right back open like a regular BVM. But if I turn this, now watch how long it takes to fill up again. See how long that takes to fill up? So the idea is you really can't go fast on this one because you have to wait till it fills up again. So that's one way to combat rate. The other way to combat rate is there's a company called O2, and they make a timing light. So if you watch this timing light, it will blink and it'll stay on for 1.5 seconds, and then it'll go off for 4.5 seconds. What that's going to give you is 10 breaths per minute. And all you have to do is pay attention to the light. The reason it stays on for 1.5 seconds is so that you don't squeeze the bag too fast. Like, so if it just blinked, you might squeeze the bag too fast. So that's 10 times a minute for breaths. They make a pediatric one that is 20 times a minute. The other so the company that makes that is the same company that makes this BVM, and you can buy it with the timing light already on, or you can just buy the timing light and there's a sticker in the back, and you can just peel that and stick it to your existing BVM. Well, you don't even have to put it on your BVM. Put it next to the patient anywhere where you can see the light blinking. And this BVM, this is called the CPR2 Plus by Mercury Medical. If you can see, this actually has a timing light on it. So if you pull this tab, it blinks, and then it will blink again every 6 seconds. So it gives you your 10 breaths per minute. So those are the ways you can fix the rate. You can be disciplined and not use any fancy equipment, or you can utilize the new equipment that's out there to fix human error. That's the rate issue. The last one is the pressure issue, like this, squeezing too fast. And as it turns out, if you squeeze too fast, the air coming out of the BVM, as I mentioned earlier, is coming out with more pressure. And once you hit a certain amount of pressure, once you hit about 20 to 25 centimeters of water, you're forcing air to go in the esophagus. And if you do that, the lungs fill up with, the stomach fills up with air, and eventually that's going to come back out and the patients are going to start vomiting now. And then you have real airway issues. So how do we fix that? Again, you can be very disciplined and take your regular BVM and just go like that over a second or so. That's great. Or you can buy, for example, the CPR2 BVM. So if you watch, I have to cover it up. There's a manometer right there. And when I squeeze, you see how it's in the green goes up to 20. So that's good. However, if I really went, I could get it up into the yellow or red. Now this has a a pressure relief valve that will release some of the extra pressure, but you can easily get up into the yellow and red if you're not paying attention and force that air to go into the stomach. So you can buy a BVM with the manometer on it. This one, the one I said from Palmadine, the football one, you can buy it. It's extra, but you can buy it with a manometer on it. You just kind of stick it on, and you can buy it with the manometer on it. And this is really the first one that came out that addressed pressure. And how this works is, if you see, I can squeeze that BVM, but I really can't squeeze it like as fast as I can this one. I'll try to do it at the same time so you guys can see. This is your normal BVM. I'll try to squeeze them really fast at the same time. You can see that this one went in much quicker. So this is made, it's more round and it's a thicker plastic. But on this one, it has this little switch right here. And if you turn that, now when I squeeze, it's going to make a weird sound. But now when I squeeze, it locks my hands. You literally can't squeeze. Now, if you keep going, it'll let you get air in, but it won't allow you to give all that air really quickly. So how do we fix the pressure speed issue? Be disciplined to not do it. And the only way you get that way is to constantly train using BVMs the right way, which most people don't do because for the most part, we think we're pretty good with the BVM. So you can be disciplined with the current BVM you have, or you can buy one of the BVMs out there. This isn't all of them that have fixes for the human error. Those are the top 3 issues with the BVM and how to fix them.
Awesome. Thank you. One question I had, and I think I know the answer, but in case our audience doesn't, you mentioned that under the volume segment, that using a pediatric BVM on an adult is controversial. Can you tell us a little bit more
Yes.
about that?
Yes. So when this first started being taught, and if you purely look at the numbers, this is 1,500 mLs, and the pediatric version of this is 500. Well, as a 5'11 male, you only need to give me 450, so the BVM pediatric is perfect. Not the case, because the pediatric BVM, even if you squeeze it all the way, you're probably not getting more than 350 to 400. But the other issue is the amount of volume sometimes needed to fill the lungs. So, for example, if somebody has something like cystic fibrosis and they have stiff lungs because of a disease process, the PDBVM probably isn't going to be enough pressure, if you will, pressure and volume to actually raise the chest. So when that happens, you're not giving them enough. They're not getting enough oxygen in, and those folks can retain carbon dioxide, which is an acid. So we don't want to retain carbon dioxide. We don't want to get rid of too much. We want to keep it even. So probably 8 to 10 times in my career. In fact, this just happened. I was at a conference out in the Midwest, and I did this class, and somebody came up to me and said, hey, so we just took, about 2 months ago, we took all our adult BVMs off of our trucks. We only have pediatric. And I said, why would you do that?
Yeah.
That's a gross overreaction. There's going to be some people that even though you're squeezing what you think is enough volume and you're doing the right rate, their CO2 will still be high. And what's going to fix that is a little more volume, not just increasing the rate. So not everything is a perfect fix for everything. So
Sure.
some purists, my good friend is a paramedic and a respiratory therapist,
Mm.
and he is not a fan of the idea of pediatric BVM for adults. I've used it a few times, and one of them was a male that was just really thin and probably 5'5". So the pediatric BVM worked on that patient, but it might not work on somebody that's 200 or 300 pounds. So, you can't use one size Band-Aid to fix every problem.
Sure. And we've talked a lot about like working on adults. I'm just curious because I have a toddler, and I'd imagine it's even more complicated with children. Um, because
Yeah.
if those
So
pediatric BVMs are good for a lot of adults, like I'd imagine that kids even need even less.
correct. Yeah. A common question people ask me after I talk about this. Well, what if we have a pediatric? Can we use the infant BVM? Because there's a third size BVM for infants, meaning less than one, that I
Mhm.
think is around 240, 250 mLs. And is that going to be good enough for pediatrics? Some of them, maybe a small 2-year-old that that might work, but it might not. So really, you have to train all the time, right? It's called spaced repetition training, and constantly practice the right way with your BVM. You could even do this with a balloon.
Mhm.
Buy some cheap balloons, blow them up, and just kind of do this and practice that way constantly, so it becomes second nature. So you'll do it the right way in the field. But be conscientious enough to realize, you know what, this isn't working uh, for whatever reason. I need to switch to the child one from the infant, or the adult one from the child. So yeah, one BVM isn't a fix for everything.
Sure. Well, thank you. That's all we have for today. Next time, we'll dive back into the last two common mistakes made when using BVMs. Thank you so much for joining us today, and we'll see you next time.
If you have any questions or topic suggestions for future episodes, please send us an email at podcast@ncbrt.lsu.edu. Make sure you subscribe to the LSU NCBRT Preparedness Podcast wherever you listen to podcasts, and we'll see you again next time.